Shimmy back a little bit. Okay. There you go. So again, one of the harder positions to work on the neck in, but context control, control of safety, relational motion. So I have the ability to move his shoulder girdle in relation to a still head and neck because the pillow is doing the work. I have the opportunity to move his torso in relation to a relative still head and neck because of the pillow. But if I do it wrong, everything moves. Okay? So I now have the requirement to stabilize the head to some degree. And again, the point here isn't to talk as much about the neck, it's to use the neck in lateral as a challenging position that will offer me the opportunity to be able to show how to do indirect stuff. So it's an example of indirect. My aim here is to make the soft tissue soft. So I can have the shoulder girdle, the head, and the neck, okay? Broadly, head and neck, right? So the fingers on the top side of the neck, the thumb and the relative webbing, or what I like to call the yoke, right, will monitor the neck closer to the bottom side. So posterior and bottom is going to be more in here, right? So I've got this. It's a slightly awkward position. So rolling this way tightens, rolling this way generally softens. Compression, not really. So side bending away, interestingly. So this, I didn't diagnose before, but this is just the position that he's in. Also, I don't know if you notice how impactful his normal, regular respiration is. If you look at how much his shoulder girdle's moving, just breathing normal, there's a lot happening here. So this actually becomes slightly more challenging to control in terms of indirect. But okay, so you would assume in most situations that compression would make things soften, but when I do this, it doesn't really help. It doesn't feel softer, does it?
No.
Okay, so I'm using my forearm on the top of his head to compress. However, when I drop you down here, feels softer, right? Mm-hmm. Feels nicer. So I drop on the top of his head. It's like side bending to the bottom. Okay. And then because I've pinned his head, now you see how everything can still move because it's not a good pin. So I have to be careful. Okay. So that makes everything a little softer, dropping it down. I have to prove it, pull it away, makes it tighter. I have to prove it, right? This way kind of makes it tighter generally. This way makes it better. So there we go. We got lots of softening. Context control, control of safety. I have no idea how well this is showing up on the camera. I hope it's showing up okay, but my voice should do a decent job, right? But it's in some ways bending away, dropping on with my forearm. Side bending away is a relative traction, right? So it's like, well, I can't do traction. It's like, well, you can do relative traction, dropping the head down or pulling away. And sometimes, oddly enough, it'll soften it. If I do it here, that actually probably feels like, it's not softer, but it probably feels interesting and nice. Is that fair? Yeah, interesting and nice. There we go. All right, you can sit on up. You can hit the red button, sir.